So I've been getting emails lately asking me, what should I take with me? I'm going to the Dominican Republic to get cosmetic surgery. What should I take with me? So I devised a list of things that you should have with you for absolute comforts while you are there. And if anybody that knows me or has traveled with me knows that every time I'm going to travel, I take absolutely everything that I could possibly need. So whatever it is, whatever natural disaster or cataclysmic situation, I am ready, trust me. So anyway, I devised a list of things that will actually be very helpful for you to have if you are going to the Dominican Republic for cosmetic surgery, plastic surgery. So depending on the procedure that you will have done, these things that I'm going to mention, you may or may not need. But if your procedure includes, let's say, an abdominoplasty, aka tummy tuck, liposuction, liposculpture, Brazilian butt lift, anything like that, these are some of the things you will find that will be very beneficial to have with you. So number one, and this one, a lot of people don't think about this, you should actually take with you bed liners like the ones they use in the hospital. So you may have seen them before when you take your kid to the pediatrician, for example, or simply if you visited the ER, you'll see these disposable liners that are placed on the bed. So you can actually get those on Amazon for super cheap. So when I went with my mom and my brother, I took tons. I took like a pack like that, and that I would put under them while they were laying on it, because you will be, especially if you have a drain attached to your wound, you will have leakage, and so blood or another type of liquid will get on that, and you don't want to be staining your mattress or staining your sheets and staining your stuff. So basically have those liners with you to place those under you while you're there. They're not heavy to carry in your luggage either. So you should get a big pack on Amazon for relatively cheap. Another thing you will want to have, especially if you had an abdominoplasty, whether it was a full abdominoplasty or simply a mini abdominoplasty, you will want to have, and I know it's not sexy, but just think about the fact that you're going to look really damn sexy afterwards when you heal. You want to have adult diapers. So you want to get the slip-on adult diapers. Why? Because I found that they're actually very good for you to have on, and they actually hold everything, like the gauze and the tape. You're going to have gauze and tape on your wound, but the adult diaper is actually a very good thing to have on. Especially if you also leak through the drain, it will get on the diaper, it won't get on you. It's actually a good thing to have. And if you buy them in the Dominican Republic at the pharmacy, they normally will sell them to you individually. So you'll purchase the diapers individually, or they will be much more expensive. So definitely buy them here, either on Amazon or go to the store, to the pharmacy before you go, and take a pack. I would suggest like a bag of adult diapers. You'll need them on the first few days, then you won't need them anymore. For the first week, I would say you would wear them. You also want to buy a lot of gauze on Amazon. I bought them when I accompanied my mom and my brother when they had surgery. So I bought rolls of gauze, and you have to take a scissor with you. Don't forget the scissor. So you can actually cut the gauze and customize it to the length of the wound. When you buy the gauze in the Dominican Republic, I noticed they give you these tiny little squares. So you have to buy tons of gauze so you can create like a little patches of squares going this way across the wound, which is pretty ridiculous. So I would recommend you buy the roll, and there are places on Amazon where you get tons of rolls of gauze. So you want to buy that. You don't want to get a topical antibiotic to put on your wound because the doctor is going to prescribe you one. He will probably prescribe you one called Recoveron, which is the one you should use while you're there. So you should also take with you a large-sized hand sanitizer, whether it's Germax, Purell, a good hand sanitizer. Just go with Purell, because that's the one hospitals use, for example. So take a large hand sanitizer with you. You want to make sure that your hands are clean, sanitized at all times. You can also take Lysol spray or Lysol wipes, so you can wipe down any blood if any blood gets anywhere on the ground, on the floor, or anywhere in the bathroom. You have that with you. You should not at any moment attempt to squat when you have a wound like an abdominoplasty and clean a floor if you drop blood. You should have someone taking care of you, and this person can use that those wipes to clean that up. So definitely antibacterial wipes. You should also take with you a box of gloves, non-latex gloves. I'm not sure if you have a latex allergy, but I do. So I just basically make sure that the box has non-latex. So get yourself a box of gloves, because they're going to be very, very helpful for whoever's taking care of you to change your gauze and clean your wound, and also for yourself if you have to change it yourself. Another thing I took with me, because I was going to be taking care of both my mom and my brother, was I took something like this, a pressure monitor. So you could get this on Amazon, okay? And the way this works is it's a wrist blood pressure monitor. You wrap it around the wrist, and this is how I would check that their blood pressure was normal. You don't know what a normal blood pressure is like? Well, go on Google. So basically it goes like that, and then you press a button and it will read, tighten, then tell you the pressure. So the one that I got is this one, and you can get that on Amazon. It tells you how to work it and everything. So you want to make sure that your blood pressure is good. Another thing you can take is a thermometer. Make sure you don't have any fever. You do want to be reporting to your doctor if you find any abnormality. You don't want to be messaging your doctor all day. So it feels like I have a fever. Well, no, check if you have a fever. Don't just contact your doctor because you think you may have a fever or you think your blood pressure may be, out of whack. You want to contact your doctor for important things, and your doctor will give you that follow-up if he is a doctor that's responsible. So you want to also take with you, you're going to be wearing a compression garment that the doctor gives you when you're right out of surgery. You have to stay in the Dominican Republic for a minimum of 2 weeks. You cannot leave before 2 weeks. So if you do not have the time, if you cannot go, if you don't have the time to heal, then you don't have the time to get surgery. And I'm just going to say it straight up, just like that. I was there in the Dominican Republic for a month, and my brother and my mom, and they both had pretty similar surgeries, except of course my brother didn't have a BBL. They had relatively similar surgeries in the fact that they both had abdominoplasties. It takes different time for different people to heal. People don't all heal at the same pace. So you don't want to rush recovery. So if you don't have time for recovery and you're going to put yourself at the risk of something going wrong in your aftercare, then you should probably wait until you can actually take the time to recover. You will need to be in complete repose. You can't be moving around. You just have to lay there basically and be a vegetable until you can stand up and walk carefully and get your body in motion little by little. So you're gonna get a compression garment. Now this one goes up to the knee, but you can get a compression garment similar to this one, which is by De Prada, Fajas de Prada. And you could get a compression garment on Amazon, or if you'd like, also you can purchase your compression garments, the second one which you will be wearing, not the one you just wore after surgery, but the second one that you have to wear once the swelling goes down, because your body must remain compressed at all times so that the swelling goes down. The inflammation needs to go down for you to recover. So you can purchase it over there. It just will be a little more expensive. However, the benefit to it is that you will most likely be measured and you'll get one that is your right size. Because if you purchase one here that is too small and you're not able to use it, you end up just wasting your money. So you can wait until you're actually there. The second one that I purchased over there was about $150, and on Amazon you could get it a little bit cheaper, but it's around that range anyway. So definitely get yourself a faja if you think that you're pretty good at knowing, you know, what kind of measurements you're going to be looking at. But I don't think it's really good to it's really easy to predict that because of the swelling. You're going to be extremely swollen. So you can probably wait till you get there. Another thing that I would recommend is that you get yourself a Go Girl, and I mentioned this in a previous video. A Go Girl allows you to pee standing up. When you have an abdominoplasty, bending, squatting to sit on a toilet to pee is excruciatingly painful, especially if you had liposuction as well. It doesn't hurt at the wound where you got the tummy tuck. That's not where it hurts. It hurts around your body where you got liposuction. That's what hurts. So in order to avoid that pain, and this was actually very helpful to my mom when I recommended it to her, is since your faja, your compression garment, actually has a space in the middle in your groin area, you will want to use this, which basically is something you hold like that as you pee, and you can pee standing up without having to squat or getting any urine on your faja, which is great. So you keep clean and you have that. You can also get feminine wipes if you want to wipe yourself down with feminine wipes. Summer's Eve feminine wipes are really good. So once you pee, you wipe yourself with the wipes and you get back to bed, because that's where you should be, in air conditioning, away from mosquitoes, extreme air conditioning. Okay, another thing I'd recommend that you get is take with you, although you could ask the person taking care of you to make ginger tea for you. You can get a box of ginger lemon tea, so you can have ginger tea every single day, whether it's in the morning and in the night, which I recommend you have it twice a day, or in the morning or in the night, you pick. But it's a great thing to have because it will help you, the inflammation go down faster, and it'll help you drain faster any excess fluids you have in your body after liposuction. So other things you may want to take with you are repellent, mosquito repellent. If you must step outside, you do not want to risk, for example, getting any mosquito-borne illness. So definitely wear mosquito repellent. While I was there, the Zika virus was like all over. Everybody was getting Zika. So I would recommend that you take mosquito repellent with you. I know it smells nasty. You don't put it anywhere near your wounds, obviously, but on your arms, legs, things like that. You will want to probably take snacks, like sweet snacks, like candy, gum, Skittles, whatever. I'm not saying take a little stash of freaking candy with you where you're gonna gain 50 pounds while you're over there. I'm saying take some snacks because it's gonna help you. If you feel a little lightheaded, I notice that sometimes if you know, it could be your blood sugar. So take something sweet, like to suck on. You could be nauseous. You could get nauseous after surgery. So definitely take some gum or take some sweets with you. What to wear while you're there. You won't really be wearing underwear. You will be wearing your compression garment, which actually is underwear built in. If you want, you could take, you know, a pack of underwear, cotton, always cotton underwear for you to wear over your compression garment if need be, but it's not really necessary. Nightgowns, like you get a couple of really comfy cotton nightgowns. That's basically what you will be wearing as you recover. You don't want to wear anything tight, any tight clothing, any tight jeans, anything like that. Leggings are good. You could wear leggings and just loose fitting tops. Remember, you're going to be wearing tight, sexy clothes once you recover, so it doesn't matter, you know, what you wear while you recover. The most important thing is to be comfortable. I took Neosporin topical antibiotic with me just in case I get mosquito bites, because I am allergic to mosquito bites. Like, I will get a huge swollen rash when I get a mosquito bite, so I would take that just to put it on the bites. What else? Listen, you don't want to be washing your hair every day, so you're going to need a cap for your hair. Okay, so do not wet your hair every day. Can actually make you feel very dizzy and make you feel nauseous. Don't wash your hair every day. Take a cap with you so you can cover your hair when you shower. And normally that's what you're gonna find, showers. That's what you'll be doing, showering, not in a bath, laying in a bath. So take a hair cap with you. Take magazines, books, things that will keep you entertained. Preferably stay at a place that has Wi-Fi for you, free Wi-Fi for you, and where you could connect your phone and be on your phone, on your tablet, and connect with the outside world as well. You know, enjoy your stay while you're in the Dominican Republic, but also you want to be in communication. A good thing is to also, and not a lot of people think of this, but of course, because I'm paranoid, I think of these things. The electricity, sometimes the lights go out in the Dominican Republic, sometimes even twice a week, depending on where you are. So it can go for hours. So you don't want to be without any communication. So a good thing you can have with you is one of those portable chargers that they sell. They sell them at Walmart, they sell them everywhere. Target. It's a portable charger for you to charge your phone or your tablet in case the lights do go out. At least you have, you can get on your phone and play, you know, games, or get on, you know, WhatsApp or whatever. Sometimes the lights will go. Unfortunately, sometimes the Wi-Fi will go if the lights go, which sucks. But if you take some good books and magazines, you'll be good, because normally it comes back in a few hours. It doesn't take the entire day. So definitely take with you a portable battery charger. And absolutely, and I may be forgetting some stuff, but absolutely take with you suppositories. You do, especially if you're someone that has like chronic constipation, or you find yourself that you don't go every day, you want to take suppositories with you, because you cannot push while you're sitting on the toilet. And sorry for the graphic explanation, but you can't be pushing while you have an open wound across your abdomen. So you want to take suppositories with you, or something that's going to keep you regular, where you could use the bathroom at ease without having the necessity to push. So definitely have suppositories for yourself, because that can become very painful. So that's basically my list. You know, there may be some things I'm missing. If there are, you know, and you want to help people out, you can definitely comment below and add those things to the list. But like I said, medication, antibiotics, the actual antiseptic wash that you'll be using for your after surgery, those will be prescribed by the doctor, and you can get them at the pharmacy there. So you don't want to carry a whole pharmacy in your luggage. So definitely have those things. Take with you maybe something that reminds you of your family, like if you have kids, something that, you know, even a drawing that they made for you, or something they wrote to you. That's good to have around, especially when you're gonna have surgery. You feel very happy that you have that. You can even take it with you, you know, on the day you have surgery, and keeps you feeling safe. So definitely do that. And yeah, that's my list. If I missed anything, again, you can add it at the bottom. And again, my email will be at the bottom in case you have any other questions for me. And I hope you found this video helpful, and take care. Have a great day.